In this lecture, we will discuss right arm, left leg lead reversal and how to identify it on the EKG. Making sure that the EKG leads are connected to the correct electrode position is important for getting accurate rhythm strips in 12-lead EKGs. If the leads are reversed, we call this lead reversal, it can often produce EKG abnormalities. It's important to be aware of these accidental misplacements of the limb lead electrodes because they may mimic various pathology, including chamber enlargement and ectopic atrial rhythm, or even myocardial ischemia and infarction. Now, when the limb electrodes, that is the left arm, the right arm, and the left leg, are exchanged without disturbing the neutral electrode, which is the right leg, then Einthoven's triangle is flipped 180 degrees or rotated. This results in leads that are switched in position. They become inverted or remain unchanged depending on their initial position and the vector. Remember, the goal for us is to be able to see why these EKG changes occur and then be able to reason them out on our own instead of memorizing all different various aspects. We'll also mention a few things to keep in mind in order to spot this right arm, left leg lead reversal out. So again, here we're looking at the right arm, left leg electrodes and what happens when they're reversed. In other words, there's a 180 degrees vertical rotation around the AVL axis, okay? So again, this will be our normal EKG, and we'll see this is what we see in this right arm, left leg reversal, okay? So what we're going around here is AVL. So here's lead AVL, okay? And that will be our focal point that we put everything around. So if we draw a line down here, okay? So the first thing is draw out your Einthoven's triangle, label it, okay? Here's AVL. We're going to rotate everything around it. Here's our right arm and our left leg. So these are going to switch places, okay? So the right arm will come down here, and our left leg will come up in this position. Okay, so that's what we have going on. This is 180 degrees vertical rotation around the AVL axis. Now, because we're rotating around AVL as the focal point, AVL will remain unchanged. With all the other leads, they'll become either inverted or switch places. In this case, lead 2 will become inverted. Leads AVR and AVF will switch places, and leads 1 and 3 will switch places and become inverted. Okay. So let's take a look at this. We have a little more going on here. So we said AVL is unchanged. This is the one we're rotating it around. So AVL, which is right here, is unchanged. Okay, so no changes to AVL. Lead 2 will become inverted. Okay, so let me just erase this here. You can see that we're rotating around this, and here's lead 2. Because we're switching places, it's now inverted. So lead 2 now becomes inverted here. Okay, so it goes from positive to now negative. So, okay, that's one thing to keep in mind. We said the ones that switch places will be AVR and AVF. Here's AVR and AVF. So just like our electrodes, we can now see AVF is here, and now we have AVR down here. Okay, so AVR, AVF, we're simply going to switch those places. So AVF is here, it now becomes positive, okay, and AVR, which is down here, is now going to make AVF, in this case, negative, okay? So hopefully that part makes sense. Now there's another thing that you should know here is that 1 and 3 will switch places, and they'll also become inverted, okay? So why is this the case? So again, we're rotating around this axis. Here's lead 1 and lead 2, so it makes sense that this becomes 3 and this becomes 1, okay? So we can see that here. Here's 1 and 3. Okay, they're switching places, but we also said they become inverted. Now, in order to know why this is the case, you have to know the directions in which they're directed. Okay, so lead 1 goes from the right arm to the left arm, and lead 3 goes from the left arm to the left leg. Okay, so what you're going to do here is now you're going to rotate it around this. Okay, so now lead 1 will go from will go in the opposite direction. Instead of going this direction, it's pretty much going to go this direction, which is mostly opposite, okay? In lead 3, instead of going this way, which you can almost consider going in that direction, it's now going in this direction, okay? So it's going from the right to left. So right to left, it's now going instead of left to right, okay? And lead 1, instead of going from right to left, it's now going from the left side to the right side, okay? And that's why you get that inversion of those leads, okay? So now you can see that lead 1 here is becoming an inverted lead 3, Okay, so you can see that this was positive in lead 3. Now it's becoming negative, but it's still lead 3 inverted. And then lead 3 in the reversal is going to be an inverted lead 1. Okay, so notice this is lead 1. You can see now it's inverted down here. Okay, so inverted lead 1. So a little more going on than we've seen in previous lectures, but hopefully that makes sense. Now, some other clues you should think of when you see right arm or left leg reversal are when leads 1, 2, 3, and AVF are completely inverted, including the P waves, the QRS complexes, and even the T waves. In addition, lead AVR will normally be negative, and in this case it's going to be upright. Okay, so notice AVR was negative here, and now it will be upright. So that's another thing to think about. And remember, you're going to see inversion of leads 1, 2, 3, and AVF. Okay, so hopefully that makes sense. And they're inverted because remember, lead 2 becomes inverted, okay? And then leads 1 and 3 become inverted and switch places, all right? And then lead AVF is switching places with AVR. So that's why you see that inversion in that case, all right? So let's briefly review what we discussed before we end here. So this is the right arm, left leg reversal, okay? So right arm to left leg, and this is our AVL, or rotating it around AVL. This is our right arm and left leg, so they're switching places, and in that case we're going to see AVL will remain unchanged because it's our focal point. We're rotating it around. We'll see inversion of lead 2. AVR and AVF will switch places, and then leads 1 and 3, remember that direction, are going to switch, so they're going to become inverted, and they'll also switch places. Okay, remember the clues to keep in mind are 1, 2, 3, and AVF. So our inferior leads plus lead 1 will become inverted, and lead AVR, which is most oftentimes negative, will become upright. Okay, so that's the end of this lecture. We discussed right arm, left leg lead reversal and how to identify it on the EKG. I hope you learned something.